Hi everyone. Now we are going to discuss the topic that is artificial reproductive technology. Artificial reproductive technology. Short form that is ART. See, this is a artificial reproductive technology. The one who are not eligible for the sexual intercourse, we are going to use this type of the method. Okay. In that things, first we are going to discuss that is intrauterine insemination. First thing is intrauterine insemination. We already discussed the previous video, the normal sperm count more than 15 million. So when a patient having the sperm count, or when the husband sperm count is less than 15 million, means 5 to 15 million, if the husband have the sperm, we can use this method. Which one is that? Intrauterine insemination. The short form is IUI. So in the IUI, what is the sperm count level? 5 to 15 million. 5 to 15 million the sperm count. See, when we are going to use this method, first condition I already told you, 5 to 15 million. After that, when the condition having anti-sperm antibody in cervix infertility. It means in the cervix region, that's a content anti-sperm antibody. From the word itself, you can understand it will against the sperm entry. So the sperm can't enter by the cervix region. So in that time, we can use the method that is intrauterine insemination. The next thing is infertility, erectile dysfunction. Infertility, erectile dysfunction. In that condition also, we can use the method intrauterine insemination. Third thing is failure of semen deposition. Failure of semen deposition. See how we are going to use the method means, listen very carefully. We all already know this is the cervix, uterus, fallopian tube and the ovary. This is vagina. So if something happen, that is, first we are studying anti-sperm antibody in the cervix. So here it will prevent the entry of the sperm. The antibody which is present here, it will prevent the entry of the sperm. In that condition, then the erectile dysfunction condition. Next thing, the failure of semen deposition. These three conditions are the sperm count 5 to 15 million. We are going to use the method that is intrauterine insemination. Now, intrauterine insemination, from the word you can understand, we are going to take the sperm and put into the uterus. Now the sperm will go to reach the ovary via fallopian tube. That is the main thing. This is the fallopian tube. I am going to put the sperm in the uterus, and then the sperm will go to reach the ovary for to form the fertilization via the fallopian tube. So these are the method we are going to use, the intrauterine insemination. Now, if the condition happen, if the patient have any adherence formation, means any blockage in the fallopian tube, that first thing, tubal potency. It means problem in the fallopian tube. The next thing, if the sperm less than 5 million. I already told you 5 to 15 million, we are using intrauterine insemination. Now the sperm count less than 5 million. In that two condition, intrauterine insemination is contraindication. Which condition? Tubal potency and the sperm count less than 5 million. In that two condition, we are going to use the method that is called the in vitro fertilization. Or the ordinary people or the normal people, non-medicos, everyone will say that is test tube baby. That is test tube baby. In the tubal potency, we are going to do the maximum. We are going to try break the adhesion. Adhesion means the reason that is going to block the fallopian tube. So we are going to do that is tuboplasty. We are saying the condition that is tuboplasty. If the tuboplasty will fail, we are going to move the in vitro fertilization or test tube baby. So in that topic, you have to remember anti-sperm antibody in the cervix, infertility, erectile dysfunction, failure of the semen deposition, and the sperm count 5 to 15 million. We are going to use this all condition, that is intrauterine insemination. First thing, in the artificial reproductive technology, first we studied intrauterine infertilization. Next thing we are going to study, that is test tube baby, or we can say in vitro fertilization. Second thing, correct? Second thing we are going to study, that is in vitro fertilization or test tube baby. See, before that we study IUI, correct? We studied previously IUI, intrauterine insemination. In that intrauterine insemination, if we have one patient, okay, and we don't know why the patient have infertility, so that we condition called as unknown infertility. In unknown infertility condition, we are using unknown infertility condition, we are going to do superovulation. We are going to do superovulation plus IUI. In unknown fertility, we are going to do the superovulation and IUI. Now we came here, in vitro fertilization or test tube baby. Okay, here what we are going to do means, now listen very careful. This is the uterus and this is the cervix, vagina, fallopian tube and the ovary. In that ovary, I already told you that is the two condition we are going to do this process. First thing is fallopian tube problem. Second thing is sperm count less than 5 million. Now if the problem is occurred here, so what I am doing means, I will inject more follicles here into the ovary. I will inject more follicles here. When I am going to inject the more follicles on the ovulation, so inject more follicles and then you can get more ovum. Inject more follicle, after that ovulation happen and then you get more ovum. Now we are going to suck out the ovum by the tube, that is oocyte retrieval. Oocyte retrieval. See, first I am going to inject the follicle. After that, I can get, after ovulation, I can get more ovum, and then I will take this all ovum by a tube, that is called oocyte retrieval. Now the ovum is ready. So now I am going to take one petri dish. This is the petri dish. Petri dish. In that petri dish, what I am going to do means, I will put the ovum around the petri dish and I will take nearly 2 to 3 lakhs sperms. And I will take nearly 2 to 3 lakhs of the sperms and then I will put it here. So when the sperm will get mixes fertilized with the ovum and the sperm fertilized with the ovum, we get fertilization. So the embryo will can occur. When the sperm and ovum will merge, we can get one embryo. So we can take embryo. See, here you can get many embryo, but I am going to take 2 or 3 embryo and then again I will inject it in the uterus. After taking embryo, After getting an embryo, I'm going to inject it again in the uterus. That is embryo transformation. That is embryo transformation. And this is the second type. So second type is in vitro fertilization or test tube baby. I'm going to use this condition when the fallopian tube have problem, at the same time sperm count less than 5 million. So in this method, what we are going to do means we are going to inject more follicle in the ovary. The ovulation time, after finishing ovulation, we can get more ovum. Then I am going to suck out this all the ovum by the tube, that is oocyte retrieval, and then I am going to take the petri dish and put the ovum around the petri dish, and I am injecting 2 to 3 lakh sperms. Once the embryo will formation, I am going to take this embryo and again put into the uterus.